Welcome. Good morning. Okay. I think we can start. I'll be telling you a couple of concepts over here before I start my first PowerPoint. Okay. So stick to me. Now the important part is that we are starting for the first time an organogenesis in terms of an organ development, which is the cardiovascular system. You remember by now, or you can recapitulate a little bit, that from 3rd week to 8th week we call organogenesis. Remember that during the embryonic life? And the first system which is functional, but the first system which comes, nervous system, neural tube comes first, but the second system which is functional is the cardiovascular system. And comes from where? Comes from the lateral mesoderm. I did not go into detail of the lateral mesoderm, but if you recall, the lateral mesoderm is bifurcated. It is two. Lateral mesoderm. One is the somatic part, one is called the splanchnic part, which will cover the organs. Splanchnic means organ. Splanchnic is a Latin word, but the viscera is the organ, is the English term. Viscera or the organ. And they are supplied by different nerves called autonomic nerve. So heart is supplied by the autonomic nerve, and therefore you don't get any sensation. Our GI system is innervated by the autonomic nervous system, which is good for us. Otherwise, you will take the chicken, you can feel the chicken. This is a sensory, but the moment it is going over here, it's all autonomic. You don't get this sensation. Like I took cereal in the morning. I don't know why the cereal is there. This side, this side, this side. I don't know. No sensation. Your heart is beating. Do you get a sensation? No, which is good. So therefore, there is a special type of nerve is supplying. It's not that the heart is not beating. Heart is beating because of the autonomic nervous system. By now, sympathetic, parasympathetic nerves are there. They are controlling the functional part. So the heart is coming from this splanchnic mesoderm of the lateral plate. This is the first information you should understand that. And there are two hearts. Remember the two hearts? Because if this is the mesoderm, this is the paraxial mesoderm, intermediate mesoderm, and it is divided into two parts, and then they fold, right? So there has to be two parts. Nothing is one. Two kidney, two testes, or two ovaries, etc., are coming from the mesoderm. So mesoderm means two. So the heart tube originally comes from the lateral mesoderm, two, and then join in the middle to form one. The two tubes to form one. I'm going to show you the photograph. The two tubes join in the middle, just in the midline, to form one heart tube. Everybody knows by now that the heart is slightly tilted towards the left. And what is the story over there? I'll tell you two stories. One story is associated with which we call is the folding. Another is bending. So the heart is associated with two things functionally. One is bending, heart tube I'm talking about. Heart tube. One is called the folding, and is the bending. Now when in the early part, very early part, the blood was going inside this, and the blood was coming out over there. Now tell me with your little bit of idea that which side will be the atrium, which side will be the ventricle. Again, the blood is coming out from here, blood is going in. Which side is the atrium? At the bottom is the atrium. Very good. And tell me one vein which is going over there. Now you keep mum.
Oh, umbilical.
Umbilical vein, give a big hand. Umbilical vein. Wonderful idea. So don't forget that this is the purpose of connecting now slowly to the system. So something is going over here, has to be an umbilical vein. There are two umbilical veins originally, then the right one disappears, then one umbilical vein from the left side, it goes inside. Is that okay? I will be adding two more veins. Originally it was there, okay? And there are many changes over there, but not only the umbilical vein carries the oxygenated blood. But there are two veins which carry the deoxygenated blood, also goes to the heart. I'm coming to that. But for the time being, try to understand what is happening. So this side is the atrium, and this side is the ventricle. And if I say that this side is the ventricle, then it automatically comes to your mind that the pulmonary artery and aorta will be the final breakup from the ventricle. Pulmonary artery and the aorta, right, from here. Now this tube is divided into 4 parts. First of all, the lowest most part is we call atrium proper. And I tell you what is the meaning of atrium. Atrium proper means it is from the cardiac tube or the endocardial tube. That's why we call it the proper. Means originally it came from the atrium proper. The right atrium, I'm talking about the right atrium. Left atrium does not come from the tube. Left atrium does not come from the tube. Left atrium does not come from the tube. So the atrium, then is the ventricle. Then is called the bulbus cordis, and finally is called the truncus arteriosus. Now your head is swimming, I know. Too many things I told already. I'll repeat 10 times before you swallow it and before you can understand everything. So one more time. This is the tube. What is the name of this tube? Endocardial tube. How did it come up? This tube is joining fusion of the 2 tubes to form 1 tube. And it has the 4 parts: atrium proper, ventricle, bulbus cordis, truncus arteriosus. From the top to bottom, truncus arteriosus, bulbus cordis, and then is the ventricle, then is the atrium proper. Bulbus cordis, you understand everything, but bulbus cordis is making you a little nervous. That what is the bulbus? Bulbus means swelling, like can you see my swelling? You see the bulb, there's the Latin word, bulb. You know the bulb is a little bit swelled. So this exactly happens in the sternocostal surface, which is the right ventricle. Bulbus cordis, 75% of that bulbus cordis is producing right ventricle, which is the sternocostal surface, more anteriorly placed. So now, if I have to fold like this way, where is the atrium? Backside. Coming forward is the ventricle. And we have 2 ventricles. The ventricle, the word ventricle I told you, that is majority of the part is forming the left ventricle. Bulbus cordis, the majority of the part is forming right ventricle. Clear now? And the left, what is the left atrium? Left atrium doesn't come from I will tell you the story left atrium later. But for the time being, you should be able to understand 100% how the right atrium is coming. Right atrium is coming from the atrium proper and something else called smooth part. You know already what is the smooth part of the right atrium. You have a lecture on that, right? Yes or no? Inside the heart? Inside the, you have not done that yet? Okay.
Yes, we do.
Whatever, you will learn from me. Doesn't matter. This way or that we will learn. So let's do it one more time. What I'm saying is, this is the endocardial tube right in the middle. Blood is going through the bottom and coming out from the top. The bottom means the atria should be this side, and the atria means we are talking about the right atrium. And right atrium means this is the major part, which is the atria proper, which is a part of the endocardial tube. The part which is not endocardial tube is the when the blood is coming in, we call sinus venosus. There is this big space, like a pot, where all the bloods are coming. There are 3 sources of the blood from either side. It's called, one is, you know it already, it's called the umbilical vein. The 2 other names, I'm trying to complicate that a little bit, but by giving 2 other names, it's called the common cardinal vein, and the vitelline vein. Remember this thing, very important. Common cardinal vein and the vitelline vein on both sides. So we have umbilical vein on both sides, but you know that only left umbilical vein is always one, so one will disappear, right one will disappear, left one will persist. But it is associated with 2 other veins. One is called the common cardinal vein, and the second one is the vitelline vein. So total 3. They are coming to a place, spot over here, called sinus venosus. The name of that is sinus venosus. It receives the blood from all 3 veins. Well, what are the 3 veins? Common cardinal vein, vitelline vein, and the umbilical vein. When they come over here. What is the name of that? Sinus venosus, which is attached to the atrium. So now the right atrium has two parts. One is the rough part, which is the atrium proper, and the smooth part, which is the sinus venosus. Period. If you go back to your gross anatomy class, the lab, I think Ryman or Atif must have shown you that this is your right atrium. It has the smooth part and the right atrium. You don't have to memorize anymore. You know the smooth part. Oh, Dr. Atif, stop it over there. I know smooth part is coming from the sinus venosus. Vein is usually smooth. This is usually rough because it's a tube. So the smooth part and rough part. So again, this is four parts. One is called the atrium proper. That's the rough part of the right atrium. Then is the ventricle. Mostly it is forming the left ventricle. Then is the bulbus cordis, which is, if you see the right ventricle right now, it is a little bit thin. More you do like this, more it will be thin. If my chin is over this much, it will be very thin. You can puncture. You got it? Bulbus cordis is coming from the bulbus cordis. And then is the truncus arteriosus, which will form the two parts, one the pulmonary artery and the aorta. Pulmonary artery and the aorta. Let's do one more time. This is the endocardial tube. After joining, it has four parts. Atria proper, ventricle, bulbus cordis, truncus arteriosus, which will form finally the aorta and the pulmonary artery. That will be connected with the right ventricle, mostly pulmonary artery, and the left ventricle is a little bit attached to the aorta. And then you have the atrium. This is the atrium proper, and then below that is the sinus venosus, which receives blood from 6 veins, 3 this side, 3 this side. And the name of the 3 veins are umbilical vein, common cardinal vein, and the Vitelline vein. Vitelline means it is coming from the GI system, gastrointestinal system. I go through that the venous system at the end of my presentation, not today, end of the final presentation of this block, venous system later. I'm just orienting you, and it's very important. Now, when folding is okay, you understand that the atria has gone posteriorly, everything is clear to you, but you don't understand the fact that why the heart is shifted towards the left. The apex is towards the left, yes or no?
Yes.
Why? It could have been this way, that way, why it has to go to the left? I'll tell you the story. So the bending is clear to you. Like right now, if you want to see the left atrium, it's forming the base, posterior part, which is coming not from the tube, but from the swelling of the pulmonary veins. Swelling of the pulmonary veins give you the left atrium, and it is posteriorly placed. Is attached to the right atrium, slightly posteriorly placed. Right atrium is slightly right side and posterior, and in between you have the transverse sinus. So now the students were memorizing when somebody, Dr. Akif or Atif or whoever taught you the transverse sinus, you were thinking, you were memorizing, and he must have said anteriorly there will be big arteries,
Yes.
pulmonary artery and the aorta, and posteriorly of the superior vena cava or the right atrium. Now it makes sense to you why the right atrium and the superior vena cava has come to the posterior side anteriorly, and that's the transverse sinus. No memorization. The common question people ask, what are these structures in front of the transverse sinus? Aorta and the pulmonary artery. What are the structures at the back? Superior vena cava and a little bit of the right atrium. Because they are all slightly posterior. So right atrium is like this now. It's a little bit right side, but a little bit posterior.
Right oracle.
You can see that. Are you enjoying? Okay, now final part is before I did not show you any slide. I can finish this lecture without showing anything. This is good enough for me. This is good, and you will understand. I guarantee you will understand. Don't be hooked up with the words written on the PowerPoint, but remember this and enjoy through a concept. Now I tell you why. So the 2 tubes and the right in the middle, but then we came to know that the apex is this is the apex. It's going towards the left side. How it is possible? So the heart at that time will bend towards the right side. Now you see there what is happening, it goes to the left side. If you think about me, which you are because I'm in that focus right now, if I bend towards the right side, look at my bum, apex, going which side?
Left side.
Left side. More I bend, more left side. And that's exactly is happening. So the two concepts over there, folding and bending. Will you remember? Folding and bending is the story of the heart, beginning of the story.
Why do you bend?
Why? Genetically control. There are 500 genes. I'm coming to that 500 genes. Not even a single gene you have to know. Except give some importance to the neural crest, which is, I told you earlier, neural crest cells. They are genetically controlled. But you understand that? Folding, bending. Folding, bending. Now, the heart is bending towards the right side so that the apex goes left side. If the heart is bending towards the left side,
The apex will be the right side.
then apex will be on the right side. This is called dextrocardia. It's also not very uncommon. Some of the heart, maybe my heart is on the right side. I'm okay. Everything is okay. Only the apex is pointing towards the right side. Left ventricle is on the right side.
Okay.
Otherwise, everything is okay. It will pump the blood to the aorta. Everything is okay. This is called dextrocardia. Dextro means towards the dextro means right type of thing. You know, the chemistry you will learn that. You know, levo or whatever. I forgot that. Is the left, isn't it? All Latin word though. All Latin word. Anyway, is that clear to you? Before I start this first slide, okay? You will enjoy my slide now. Okay. Now, this is exactly what I said to you, that the following section on clinical embryology is based on understanding of the normal heart development. Once the concepts are clear, the student should appreciate the developmental defect. So, developmental defects, I give you at the outset, my next slide will be all the developmental defects that you have to know before your exam. Yes? Turn off. Okay, very good. So, the developmental defects is the clinical embryology that we are targeting. The purpose, you're a medical student, you have to know a little bit of the normal and the abnormal. A patient will come with the abnormality. Nobody comes to your clinic with the normal. I'm doing fine, doctor. Dr. Mohammed, I'm doing extremely well, you know. They will, very rarely you'll see a patient like that. They will have a problem, so that problem you have to diagnose it. So that you can understand through the normal development, okay? That's what I'm emphasizing here. This is, you will learn it next class, not today. You will learn the position and anatomical parts of the entire heart, which you understand a little bit today. Dextrocardia, you understand a little bit. This you do not understand, ventricular septal defect, tetralogy of the pallid, transposition of the great arteries, difference between aortic arch and arch of the aorta, patent ductus arteriosus. These are very interesting type of problem, which are very common, which are not uncommon. Somebody has a little hole in the heart, we call atrial septal defect. It's very common. Ventricular septal, 30% of the cardiovascular problem is ventricular septal defect. It's written over there. So all these things, I put it over here not just to make you feel bad, just to let you know that this is coming. You should do this thing through the normal development, understand each and every, very interesting, before the exam. Before the exam, not today. Okay. But let's start from the very beginning, what I said. Heart is the first functional organ to develop in order to supply ever-increasing metabolic demands of the growing embryo. I have to write it over here because this concept is there already with you. If I don't write it, you say that Dr. Paul, your slides without writing anything. Now I write, oh, how did it help you? Nothing. You know it already why the heart is. And the heart is able to pump blood on 22nd day. So how quickly the heart is functional, you can understand. Because we need the ever-increasing metabolic demand. This is coming from the splanchnic mesoderm. which I explained to you. Now let's see this diagram. This is 1,000 words. Let me orient you one more time. You have been habituated with seeing this 1,000 times. This is 1,001. I'm showing you this slide. Showing you outside is the ectoderm. Then is the mesoderm, has three parts: paraxial mesoderm, intermediate mesoderm, lateral mesoderm. Now you can see the splanchnic and the somatic part, and the splanchnic has a tube. You see the two tubes? These are endocardial tube. This will be joining in the middle to form the endocardial tube. Is that clear? Very good. And whenever we say splanchnic, it will be autonomic nervous system. This is the somatic nerve, that's why called the somatic mesoderm. So when it forms this thing, this is anterior abdominal muscle or anterior thoracic muscle. These are somatic, supplied by the intercostal nerve. This is somatic, not autonomic. If you touch my thorax, I feel. This is this, why I'm feeling it? Because it is a somatic nerve. What is a somatic nerve? It has a motor and the sensory part. Autonomic nerves is very mixed nerves, so it's very difficult to understand, and that's what it is called autonomic. It's supplying to the viscera, lung, heart, kidney, all supplied by the autonomic nerve. So this is a picture is showing the two heart is over there. Now let's do this. So origin splanchnic mesoderm, some cord mesoderm is there. Neural crest cells, please remember, I'll come back to the neural crest cells, very important. And the heart is developed and starts beating at 22nd days. Third week. 22nd days means third week. Third week, the first week is from 14 days to 21 days. The first week, second week, 21 to 28, and 28 to 35. In between, the heart is pumping. So how quickly the heart is pumping? We need it. And it's controlled by 500 genes. I'm not going to ask even a single gene. You should be jumping now, because there's nothing I needed over here. But I know for sure one student at night time, Dr. Paul, I cannot sleep without telling one gene that is important over here. I said there's nothing is important for you at your level. But one student will ask me that please tell a gene. So here are some genes. Be my friend. Be my boy over here. And then do whatever. But I'm not going to tell you anything. I'm going to tell you this thing, heart tube, like this, and my own diagram is this. Very straightforward. I tell you that three veins are joining on both sides: common cardinal vein, umbilical vein, and the vitelline vein on both sides. Come to a place where this is the place we call sinus venosus, which joins to the atrium proper
Smooth
of the endocardial tube. This is the ventricle, this is the bulbus cordis, this is truncus arteriosus, which is coming in the next slide. Everything in detail. This is the slide I want you to please spend a little time tonight. Tonight is your night. Tonight is your night. Just spend half an hour to understand this slide. Then you are okay. It will forever you are okay. This slide is telling you many things. That one of the veins is called the common cardinal vein. One of the veins is called the umbilical vein. One of the veins is called the vitelline vein. They are joining together with the other three to form sinus venosus, which is then joined with the atrium. So if the right atrium has two parts, smooth part and the rough part is coming from the atrium proper. This is the atrium proper. The smooth part is coming from the sinus venosus, which receives the blood from three sources. One is called the umbilical vein, one is the common cardinal vein, vitelline vein. Remember the fact, this umbilical vein on the right side will be gone, will be disappearing. Only the left one will persist. Everybody knows by now that umbilical vein is one. Mostly towards the development, the right one disappeared, the one is good enough to take the oxygenated blood. These two veins are giving you the deoxygenated blood. So the heart is now receiving from the oxygenated and deoxygenated blood. The vitelline veins basically coming from the intestine. The intestine is also forming, so it will have some deoxygenated blood. It will go over there through the vitelline vein. And common cardinal vein has two parts. Why it is called common? With the two veins, you can see that. One is called the anterior, one is called the posterior. The anterior cardinal vein is the superior vena cava. Now you should have two superior vena cava then, but the left one fortunately will disappear.
Just left, not right. Okay.
This one is called the common cardinal vein. Often it is called the right horn. Horn means, like this horn, right horn, and this is called the left horn, the left common cardinal vein. The right horn disappears and the whole thing goes inside the sinus venosus to form the smooth part. Right, the right part meaning, I'm talking about the right anterior cardinal vein, which is forming the superior vena cava, will go inside directly because the right horn will be disappearing. The left horn persists, left horn stays there to form the coronary sinus. This is a common question I ask in the exam. What is the origin of the coronary sinus? Your answer is left common cardinal vein. Left common cardinal vein is giving the coronary sinus. Now, if I say that we have superior vena cava only one, because the left one disappears.
Yes.
If it stays over there, then we will have two superior vena cava. The right superior vena cava, you know it very well, that it is going into the right atrium. Because, sinus venosus actually, it goes to the sinus venosus. If the left one percent disappears, 99.9999 percentile, it will disappear. But it may stay there to form this double superior vena cava. My question to you, let's see how intelligent everybody is intelligent. My question to you very simple. The right superior vena cava is going to the sinus venosus, the smooth part. If the left one survives, it will go to where? It will connect to where?
The rough part. The atrium part. The smooth part.
Don't
Sinus
say.
Sinus venosus.
Okay. I'm saying if this one persists, it will join with what? This one.
Left atrium.
What is the name of that?
Common cardinal.
Coronary sinus. And in fact, Dr. Ayman, you know Dr. Ayman, very nice person in anatomy. He tells me, I have not seen in my life double superior vena cava. In the book is written over there. He says, Dr. Paul, I saw in my life, if I'm 100 years old, he must be 200 years old. He saw in his life that a double superior vena cava exists in a cadaver. He saw it. No, in the life, I think. He was saying that in the open heart surgery, he saw that somebody called him to find out that this is the superior vena cava on the left side. But joining with what?
The
Coronary sinus. Makes sense to you now? What is the origin of the coronary sinus? It is the left horn or the left common cardinal vein. That's the message you should understand. Now let's do it more. So basically, if you spend tonight, half an hour, you will understand that the endocardial tube is divided into four parts: atrium proper, ventricle, which is forming mostly the left ventricle, bulbus cordis is basically is forming the right ventricle. This is forming the right ventricle, and truncus arteriosus is forming the two part, which is the pulmonary artery and the aorta. Okay? So, do you see the left atrium over here? You don't see. It doesn't come from the endocardial tube. It is originated from the pulmonary vein. I have a diagram, I'll show you later. Then, the tube bends, observe the ventricle, bulbus cordis, etc. come in front. So the ventricle is coming in front. Is that clear to you, this message?
Yes.
If the ventricle is over here, if it's bent, obviously the atria is going posteriorly. And ventricle is over here. And between the ventricle and the atrium, you have these two structures over here, which is the pulmonary artery and the aorta. And over here is the superior vena cava and the left atria. This space is called the transverse sinus. So transverse sinus, you do not have to, the pericardial sinus, or mesopericardium we call in the embryonic class mesopericardium, which if it is gone, mesopericardium is gone, then you can see a space over here. In the adult part, there is a space over there, which is an important space. Everybody has told you already, because you can clamp it over there. You clamp over here for the bypass surgery. And then put the blood from one side to a machine, and it goes back to the aorta. From the pulmonary vein, you connect to the machine, so all the oxygenation is happening, and then attached to the pulmonary artery and to the aorta. Yeah, somebody, I'll entertain the question later. Let me finish because I have to run, you know. Are you okay with me?
Yes.
What is a transverse sinus? Transverse sinus is a space which is achieved after the apoptosis, after the degeneration of the mesopericardium. Everything is covered with the pericardium, but you cannot see the space unless this part is gone. When it is gone, you see anteriorly there are two structures, and posteriorly there are two structures. Anteriorly is the pulmonary artery aorta, because it is attached to the ventricle. This is the ventricle. And posteriorly you have the atrium. Atrium means the right atrium with the superior vena cava. It goes posteriorly. And obviously posteriorly also the left atrium is there. Left atrium is not a part of this one. Left atrium comes, it's just a space with the swelling of the pulmonary vein. Pulmonary vein carries the oxygenated blood. So all of them go over there. The last part swells up to form something called left atrium, which is attached with the right atrium later. And this story I will tell you next class. Story today will be this one, not the left atrium. Left atrium I will tell you next class. Is it okay now? So now you are absolutely clear that what are these things happening. This is the atria proper. Below is the sinus venosus receiving blood from 6 veins, 3 this side, 3 this side, common cardinal vein, the umbilical vein, and the vital vein. This side and this side, the right and left. And then you have the sinus venosus, then you have the atria proper, then the ventricle proper or ventricle, then you have the bulbus cordis, and then it's over there. Okay? And why it is called bulbus? I told you, did I tell you? Because it swells up. It swells up. And if you see the ventricle now, the ventricle is a little thin. Makes sense to you?
Yes.
When you swell up, it becomes a little thin. My chin will be a little thin, more is like a balloon, then it will burst.
Yes.
So now you make sense that why the ventricle has a little bit less musculature, 1/3,
The right ventricle.
and then the right one. This is one, and also the force of contraction, although because right ventricle has to go only a little bit up to lung, this has to go to the leg, so it is more powerful, the left ventricle. So it's a thickness is more. Okay. Now you can see the swelling up a bit. So if I say bulbus cordis is forming what now?
The right ventricle.
Right ventricle.
Right ventricle.
And right ventricle means sternocostal surface, anterior surface. If somebody puts a knife over here, it will go to my heart. Which part of the heart it will pierce? Right ventricle. Why? Because the majority of the part is the sternocostal surface. Anything goes to the sternocostal surface will hit the right ventricle. Why? Because it is the anterior surface. It is the right ventricle. It is the bulbus cordis. So 70% of the bulbus cordis is associated with the right ventricle. 70%, quite a bit. And the left ventricle, quite a bit, 70% is associated with the endocardial tube, the ventricle. You see, the ventricle is there, then the bulbus cordis. And then the whole thing will be bending towards the right. I'm putting towards the right side, so the apex is going towards the left. If it is the other way around, if the bending is happening towards the left side, now it's bending is, this one is going to the left, this is my left, and look at the apex is going towards the right side. So now if I ask you in the exam that what is the reason for apex to be on the left side, you will be saying folding or bending? Bending. Because the bending is on the right side. And opposite will make the dextrocardiac. I'll entertain question later, please. This is bulbous meaning, and if you don't understand what is this all
Apex on
about.
the right
Because in your first time probably, this bulb you play with that every time, you change the bulb, 200 times in your house. But you never realize that bulb, what is the meaning of bulbous?
Twelve.
Now,
Bulbous means swelling.
it's swelling. Now that's why I said, if you see the real heart, I put it over here. The atrium is not very visible over there. Here is the atrium, right atrium, but towards the left side, towards the right side, right atrium, and with posteriorly placed. The ventricle is more anteriorly placed, which is the right atrium, which is swelling. I can show you. And then the left ventricle is coming towards the left side, forming the left border. Right border, right atrium, left border, left ventricle, and in between. Now, those students who do not believe my drawing now will believe me. They say that, well, how the book is writing drawing. So I'll be giving example after example. This is an example from your textbook. Here is the tube, the endocardial tube, joining in the middle to form the middle, joining the middle. So if I have a cross section, this is the thoracic area. This is thoracic. You can see when I explain to you that we look like a tube. Isn't it look like a tube now? Tube and a cylinder. I always say the cylinder is so thoracic space is there. There's plenty of thoracic space. Similarly, at the abdomen, we have abdominal space. So the heart is inside the thoracic cavity, right in the middle. Can you see it right in the middle? Right in the middle. Not shifted yet to the left side. Right in the middle. Then it will be bending this way. And the folding started over there. Now makes sense to you? Folding started? Just like that, what my drawing is. So, endocardial heart tube and its various parts. Sinus venosa at the bottom. I'll entertain your question at the end, please. Sinus venosus at the bottom. Atria proper. That's the rough part. Sinus venosus will form the smooth part of the right atrium. This is the rough part of the right atrium. Then the ventricle. This is mostly forming which part of the ventricle? Left or right? Left. Right ventricle is coming from where? Valgus cord. Will you remember this? Valgus cord is mostly coming from the right ventricle, and the ventricle, some part is right ventricle, but mostly it is the left ventricle. And then truncus arteriosus means pulmonary artery and the aorta. And the folding of the tube and the foramen septum, these will be discussed later, don't worry. But now, when I said that, tonight is your night to understand that slide plus this slide, read it, everything is same, I did not say anything special, a specific part that you don't know yet over here. Everything is, the two tubes migrate together and fuse to form a single primitive heart tube. The tubular heart, which quickly forms 5 distinct regions from head to tail, is the truncus arteriosus, valgus cordis, the primitive ventricle, primitive atrium, and the sinus venosus. That's all it is written. And the rest of the thing you read it, everything is clear to you. I'm not reading because everything is done already. Again, showing you the two tubes forming one tube, and this is the cephalic end of the top portion. We're showing you pulmonary artery and the aorta, and then immediately the truncus arteriosus, valgus cordis, ventricle, atria, and then the sinus venosus with the two horn, which carrying the 3 veins together. Yeah. Now you can see how it is folding. This is called folding. It's written over there, folding of the heart, not the bending, folding of the heart is over here like this. And if you see the venous portion has gone posteriorly. Can you see it?
Yes.
Venous portion has gone posteriorly. This is the right atrium will be forming. Right atrium is coming up over there. Left atrium, it is not a part of the tube, but it will be joining from backside. If you go back to the anatomy department now, tomorrow is your lab. If you have extra time, you make it. See where is your left atrium, right atrium. Right atrium forms the right ventricle, but a little bit posteriorly placed. Left atrium definitely is forming the base, is at the very back. You cannot see if I show you the heart, this is the heart for example, what you see is the ventricle. mostly ventricle. The sternocostal are mostly the right ventricle. Coming from where? Bulbous cordis. Left ventricle coming from the ventricle proper, which is the tube, endocardial tube. Left ventricle and right atrium coming from where? Two sources. Smooth part, rough part. Smooth part is coming from where?
Sinus
Sinus venosa. Very good. And the rough part is coming where?
Atria proper.
From the atria proper. Finished. Now, in the lab, somebody was saying this is called smooth part. You are memorizing it. Smooth part, rough part. God knows what does it mean. God knows. Khalivali, you know. I have to remember smooth part. Now, medical students will not do that. They have to have a reason for everything. Smooth part means venous side, sinus venosa. Period. Where all the veins are going into that. So, including superior vena cava is going into that. And the rough part means it is the rough part, the original atrium of the endocardial tube. Is it helping you? It's
Yes.
tough for me to explain 4 times, you know. But tell you the truth, other class understood it. I hope you understood it.
Understood.
You are better actually.
Thank you.
Pushing you a little bit. Now, slowly the bending starts. Folding is already there. You can see the folding, and everything is backside toward the left side. This is the. Now let me orient you a little bit. This is the real ventricle.
Left ventricle.
This is left atrium, and this is sinus venosa. Obviously, sinus venosa. The left atrium I did not discuss with you. Is not part of the. This is not the correct way to put it. Left ventricle. I have a diagram better than this. This is not correct. 100% correct. I'll show you why. But this is the ventricle of the real ventricle, the left ventricle.
Yes.
And this is the bulbous cordis. You can see the bulbous cordis. It's written over there, bulbus cordis, bulbus cordis. So from here to here is the bulbus cordis. Then is the left ventricle. And this left atrium is coming from nowhere. It is not part of this. And this is the sinus venosa. Is it okay? I'll show you my diagram to make sure I have it. Now, look at my diagram. Look at my diagram over here. The lower part I enhance. This is the lower part of this same diagram. This is the diagram. I increase that tenfold magnification, this area, tenfold. It will look like. Now here you look at my left atrium. Does it show that it is coming from the heart tube? No. It's additional structure. It's coming from the pulmonary vein which is carrying the oxygenated blood. So I put red. This oxygenated blood is coming over there. And then I separated the right atrium into 2 parts. One is the sinus venosa, the blue one, and the rough one is coming from the primitive atrium. So this is 10 times better diagram than the other one. It makes sense to me. It should make sense to you. And what did I write? Observe the addition of the left atrium. Addition, I said. I use the word addition. Right?
Yes.
So therefore it is addition, and this is the interatrial septum, it will be there. The story I will tell you more detail next class. But for the time being, it is not a part of the endocardial tube. The endocardial tube part is the sinus venosa, is joining with that. It starts with the atrium proper. Atrium proper, ventricle proper, primitive ventricle. Then is the bulbus cordis. Then is the truncus arteriosus. Then is done. Beautiful. And then is the bending. It moves to us. It's not difficult at all. And if you want to know a little bit more on this thing, so it's very simple. What I was trying to say over here, this is the common cardinal vein. It has an anterior cardinal vein, posterior cardinal vein. Anterior cardinal vein is actually forming the superior vena cava. And the right horn is this one, common cardinal vein, right horn. This disappears, everything goes inside the sinus venosa. But here, it does not. The left horn remains there. Left horn doesn't disappear, forming what? Coronary sinus.
But the left veins, they disappear.
Yeah, you are right, very good. This disappeared, this disappeared. But if it stays over there, then is a muscula. Then is the left superior vena
So
cava.
superior.
So left superior, this venous abnormality I'll tell you more in detail at the last class, end of my last class, in this block. I'll talk about that. It will come back again to you. So at the end of this block, you should be a super embryologist of the cardiovascular system. I promise that will happen. So much interesting thing is ahead, and so much things to talk about that. It's not for the memorization. It will come with the automatic thing. If you have a little bit picture like this, and you see that, so this picture is 100% clear to you. Just go through one more time. Primitive atrium, sinus venosus, the right common cardinal vein, left common cardinal, this disappears, this stays to form the coronary sinus. So the question I put it intelligently, I have to say intelligently, it is from me. So is that if the left superior vena cava exists, persists, it will join with what structure? Coronary sinus. Now never forget that. Never forget that. Now this is a picture. I'm just going through the photographs again. The pictures is very clear to you. You see the folding and the bending. Bending starts immediately. You can see the bending on the right side. Can you see the bending right side? And the apex is going towards the left. I have a better picture. This picture. I like it. This one looks like me. When I did that, it's a bending towards the left side. Bending towards the left side. See the bending this side?
Yeah.
Apex is going towards the right. This is bending towards the
Right side.
right side. Because this is the right side of the diagram. The right side. And look at the apex.
Left side.
On the left side. It's very simple. Now you can explain to people, those who are in the school even, if you have your neighbor, cousin, or those kind of people who are in your home, there's this cardiovascular system in the book. Even in the school, all of you gone through the cardiovascular, little bit of that. And everybody says the heart is on the left side. Actually, they mean the apex of the heart is the left side. Now you can say that, why it is, because of the bending. Not folding, because of bending. Folding is responsible for the transverse sinus. And that is the picture over here. You can see it is covered with the pericardium initially, so it's called the mesopericardium. Then it gone by apoptosis, leading to a space in between this posterior and anterior part of the folding. Anterior part of the folding is this structure. These are the truncus arteriosus, so the aorta and the pulmonary artery. And posteriorly you have the right atrium and the superior vena cava. And very important because you clamp over here to make sure that you can do the surgery. I do not have to say many things. This is probably my last slide, Before I go to the next one, come to the liver and all these things will be next class. I'll do it. Thank you very much.